Hansay, good morning. My name is Niki Ashton. I'm the Member of Parliament for Churchill, Keewatinook Aski, and the Deputy Critic for Indigenous Services for the NDP. And I am honored to stand here with leaders from our region, Chief Yellowback from Manto Sipi Cree Nation, Chief Hill from Shamattawa First Nation, Grand Chief Walter Wastesicoot from the Keewatin Tribal Council, Grand Chief Garrison Settee from MKO, Manitoba Keewatinowi Okimakanak, and Grand Chief Merrick of the Assembly of Manitoba Chiefs. And we are here to talk about the humanitarian crisis existing in First Nations, particularly fly-in remote First Nations like Manto Sipi, like Shamattawa First Nation. And nowhere is that health crisis, is that humanitarian crisis so visible as when you look at healthcare. You are going to hear harrowing stories of members of God's River, Manto Sipi, and Shamattawa who went repeatedly to their nursing station to get help, people that knew they were sick, that knew they needed help, only to be turned away with an inadequate support. In the last few months, God's River has lost 2 members in those kinds of situations. And the last one was a 37-year-old woman, a mother who left behind 5 children. These are stories that for too many Canadians are out of sight and out of mind. But we know that people across the country would be shocked to hear them. What we're not seeing is Indigenous services step up and act in such a way to support these communities. That lack of action is particularly evident when it comes to the understaffing of nursing stations in fly-in communities like God's River, Shamattawa, and others. We know from an order paper question that 33% of nursing stations being operated by Indigenous Services Canada are not meeting community needs at this time. And in fact, in their own words, we know that all remote and isolated ISC-managed nursing stations have experienced reduced capacity due to staffing shortages in the past 2 months. All Manitoba and Ontario nursing stations ran below capacity for at least 1 day. So if we flip that, we know that there has not been 1 day in a nursing station in Manitoba or Ontario where they have had a full complement of staff. We've heard from people on the front lines who are suffering from burnout, who are overwhelmed. We know that there aren't enough nurses to meet communities' needs. In fact, Chief Yellowback just a few moments ago shared the story of a nurse that had to drive on the ice road from the neighboring First Nation because they didn't have any nurses in God's River at this time. And a nurse had to drive in through very difficult conditions to make it to support the community nursing station. So our call here is this is a humanitarian crisis. These are First Nations that have clearly come out and called for immediate action from Indigenous Services Canada. We cannot afford to lose another life. We need ISC, we need Minister Haidu and the government to step up and support First Nations like Manto Sipi, like Shamattawa now. I'd now like to turn the floor to Chief Yellowback from Manto Sipi Cree Nation.
Hi, good morning. Chief Michael Yellowback from Manto Sipi Cree Nation. And today I stand here with Niki Ashton to bring to attention to the challenges that we face up north, and particularly our nursing stations. And within the last 9 months, we've lost 2 of our community members where they've tried to seek medical attention only to be denied and ending up passing away. First one was on June 20th. A 48-year-old man, 2 weeks straight, tried going to the nursing station, given Tylenol, denied of further assessments outside our community, only to be sent home. And 2 weeks later, he passed away. And recently, we had a 37-year-old woman, same thing, seeking medical treatment, but did not get that adequate medical attention she so deserved. She left behind 5 children, 1 grandchild. You won't see this in an urban environment. We have major issues of nurses shortages in our community. There's not a full complement of staff, and this is resulting in the inadequate treatment of our community members, where they're getting lack of healthcare quality in our community. It's having a dire impact in our communities, and Canada being posted as one of the best countries to live in. We're living in third world conditions in our communities and healthcare. Canada recently announced billions of healthcare transfers for the provinces, yet excluded the First Nations nationally. Not even our national chief was invited to participate. Not even our regional PDOs. Because it's continuing to be a systemic system that has an issue in in our Indigenous communities, where we are being denied of healthcare even for our community members. How would you feel if you went to our community, went to our nursing station? How would you feel only to be given Tylenol? Tylenol seems to like our Health Canada nursing stations. They think that's a wonder drug for everything. It's not. Our community members have kind of have a second opinion because it's too costly to travel out. Over $1,000 for a return airfare from God's River to Winnipeg. On top of that, you have to incur hotel costs. And 80% of our community members are on fixed income. They don't have that luxury to get up on a plane and fly out. And that's one of the things that our community members said it's having an impact with our healthcare system in our community, the shortages of nurses and the doctors as well. Doctors come in every 2 weeks in our community, and that's not sufficient. And I think it's time for the Indigenous Services Canada, the Minister of Health, to step up and to address this crisis that we have in the healthcare system. And Keewatin Tribal Council recently declared a state of emergency. And I'm hoping that Canada, the Prime Minister, are hearing us today. That we are Canadian citizens as well, and we should be treated as such. So I'll leave it there for now.
I'd like to call on Chief Hill of Shamattawa First Nation.
Hi, good morning, everybody. My name is Jordna Hill. I'm with the Shamattawa First Nation. I come to share the few issues that we have in our community ourselves too for Shamattawa First Nation under health. There's a lot that's been happening within the community, and not only Shamattawa, but other northern communities that are facing the crisis as well. I know there's a big shortage of nursing, and we need more nursing in communities, and we need nursing community because we had some few incidents ourselves in the community where patients have gone to the nursing station to see the nurses about their issues, but the only thing that they get is Tylenol, and they get sent home from the nurses, and next thing you know, and she's passed away and on their bed. And this needs to stop, and we have to. The government has to start looking after the First Nations. We need to, and also we need to concentrate on the health part of the communities, because we do face a lot of crisis and racism. That has to stop. The government has to step in and start helping out, because we can't go any further like this, because we need proper health care. Just like when you go to the hospital in the cities, you get proper assessment. But when you're in the community, there's not really much of a proper assessment, maybe half-ass 40% assessment being done on our people. So that has to stop, and that because we don't want to be losing people going to nursing station, get denied what they want, because we do know how we feel in our own bodies when something's wrong with us. And that's all I want to say for now, and thank you for listening. Thanks.
Thank you, Chief Hill. I would now like to call on Grand Chief Walter Wastesicoot of the Keewatin Tribal Council.
On March 23, 2023, the 11 chiefs that are affiliated under Keewatin Tribal Council declared a regional state of emergency. It's 11 First Nations communities in northern Manitoba that came together to declare a regional state of emergency. You have heard Chief Yellowback and Chief Hill speak just recently, so those are two stories from two of those nations. If the 11 nations were here, represented here today by their chiefs, they would have many more stories. These are not isolated incidents that happen in our communities from time to time. These are recurring incidents of death due to negligence. Every death impacts the whole community. There's a stark difference between the service that is received in a city or a major town than that which is received in the First Nation community. If you were ill and you needed medical attention here in Ottawa, you could call an emergency number, and they wouldn't say, "Wait, we have to have a physician that will accept you." But that's what they do every day, and with people that are coming out of our communities. There has to be an attending physician on the other line that is willing to accept you. Otherwise, you don't go anywhere. There is no triage capacity at these nursing stations. When you go there, you might be able to get your blood pressure checked. Someone might be able to check your ears. They can't do blood tests and have those blood test results for you in half an hour. They can't do an EKG. What do? They give you Tylenol and they send you home. Clearly, there has to be much more done. Since we declared the regional state of emergency, ISC has reached out to us to start talking. But there's been no substantial measure to start decreasing the impact of the crisis that's ongoing in our communities. When we had the emergency meeting before we declared the regional state of emergency, one of the leaders in the room told me, "Grand Chief, you have to have a contact in each of our communities that tells you every day what's happening on the ground. Because when I get home, I'm going to walk into that chaos and I'm going to forget about this." That is how dire it is every day in our communities. The leaders' attention is on crisis every day, even in the night. I can't stress this enough. The root cause of all of this, I believe, is racism. This country was built on racism, superiority. I think I will end it there. Thank you.
Thank you, Grand Chief Wastesicoot, and I'll now turn it to Grand Chief Garrison Settee of MKO.
Danse, temiskat na ako kaganawan sa gisigag. We are here to stand in solidarity with Chief Yellowback and the Manto Sipi Nation. They've cried out and addressed very dire concerns in their First Nation. Situations where chiefs have to watch their people die because the system that we are subject to is a broken system. The system is failing our people, and most especially our remote First Nations. It's as if Canada is saying they don't matter as much as the people in the rest of Canadian society. But we're here to say our people matter too. Our people, remote First Nations, deserve the same kind of health care that anybody enjoys across this nation. When we have to see our chiefs bury their people somewhere along the way, someone has to be held accountable, because it's not the chief's fault. It's not because of the lack of advocacy. It's not because of the lack of lobbying. It's the failure of the governments and the lack of political will to do something to help our people, to help our nations. We live in a country that prides itself on human rights. But what about the human rights of our people that are dying in our nursing stations, in our clinics? This is not the country that that we should be living in, but we do. So it's time for change to happen. It's time for a critical overhaul of the system that is based on colonial regimes and policies and legislation. We cannot live under that regime anymore. Our chiefs are demanding change, and we expect change. This is no longer acceptable. This is no longer tolerable. It's time for change. It's time for change for First Nations in our remote First Nations. Segosani, hi.
Thank you, Grand Chief Settee. And now we will hear from AMC Grand Chief Cathy Merrick.
Tanse this morning, this afternoon. I'm the Grand Chief for the Assembly of Manitoba Chiefs for 62 First Nations in Manitoba. And I come here today to support our chiefs that are reaching out for their First Nations. And a lot of times we seem to forget that our people are treaty people, and that they're covered through treaty to be able to be provided the services that they need in their communities. And we talk a lot about premature deaths in our First Nations, but nobody is accountable for those deaths. And it's the people in the First Nation communities that feel that pain in the loss of a young woman that with 5 children. So the community suffers just as much when we have a loss in our First Nation communities due to the inadequate services that need to be provided. They're called nursing stations for a reason, because they're run by nurses. They're not run by doctors. There's visiting doctors in the fly-in communities. Maybe they spend half a day doing what needs assessing and whatnot. But a lot of the work is are on the nurses that are placed in our communities. They make decisions. They make decisions whether or not a person goes out to get assessed further in the urban areas. And in terms of birthing, we don't have any birthing. Let me know if you find a First Nation community that has a birthing center in their communities. Because as far in Manitoba, we don't have that. And all our women go out 2 weeks to go wait to give birth. And so these are the things that we are trying to educate Canada as to what's happening in their backyards when it comes to the health of First Nation people. And we're an industry. We're an industry for a lot of people that benefit from the poverty of our people. These chiefs here, they administer the poverty on behalf of the government for their people. And that should not be. We should have full, adequate hospitals in our communities where our women can give birth in our communities, where they don't have to send a fax to EKG to determine whether or not this person needs those services outside their community. That's unacceptable. And we will not accept that anymore. And we're going to take it to wherever we need to be heard. And I always say, as the Grand Chief of the Assembly of Manitoba Chiefs, we are not asking anything over and above any Canadian in this good country of ours, nor are we asking for anything over and above than any Manitoban in Manitoba. So we just ask that we be treated in a good way and that we be treated as people in this good country of ours. Egosane.
Thank you, Grand Chief. You've heard powerful testimony here today, and you've heard a clear message that we need the Prime Minister, the Government of Canada, ministers responsible to act now. I want to share that I was in Manto Sipi just over a couple of weeks ago. I visited, spent some time on the winter roads as well. And what I heard in that community and in other communities that I visited over the days that followed was that things are getting worse. This is not a moment in time where, you know, we need some catch up. This is a downward decline. So as we hear of the healthcare crisis across the country, the healthcare crisis on First Nations and particularly remote First Nations is acute. We are talking about a lack of service and support in a way that it's never been seen before. And so today, what we are saying is that this is not the time for hollow commitments to reconciliation. This is the time for action to save lives. Lives like the 37-year-old woman in God's River, like the person in Shamattawa who are no longer here, whose kids carry on, whose community is still grieving. And we are here to call for an immediate response from government when it comes to the healthcare crisis, the humanitarian crisis that God's River, Shamattawa, and other remote fly-in First Nations are facing in northern Manitoba. Thank you, Egose, and we'd like to hear any questions you might have.